States. For thousands of years, it has been the traditional land of the Huron-Wendat, the Seneca, and most recently, the Mississaugas of the Credit River. Today, this meeting place is still home to many Indigenous people from across Turtle Island, and we are grateful to have the opportunity to work on this land. I now invite Adol, my colleague, who will give us a little brief on our ASAP history.
Thank you, Ty. ASAP was born out of community activism when in 1989, a South Asian couple died unable to access AIDS services in their own language and cultural context. A group of South Asian queer activists came together and with support from ACT, AIDS Committee of Toronto, formed the South Asian AIDS Coalition. In 1995, ASAP was incorporated as an independent AIDS service organization. Over the last 30 plus years, ASAP has grown with diversified staff and services committed to providing culturally responsive and holistic health promotion, support, and settlement services for people from South Asian, Indo-Caribbean, Middle Eastern, and related communities who are living with, at risk of, or affected by HIV and related health conditions. ASAP is focused on advocating for racialized LGBTQIA+ communities, specifically in the areas of sexual and mental health.
Over this time, we've seen our communities grow with many newcomers and those who reside within the city limits and beyond. So just a short description of the different teams that work for the Alliance for South Asian AIDS Prevention. To start off with, one of our main functions is the support function, who work closely with people affected by and or who are living with HIV and AIDS. We have the education team who are responsible for holistic training programs, community engagement and outreach. One of our recent development and initiatives has been the settlement services, who help newcomers with their immigration process and help them settle and integrate into community. So they are funded by IRCC. And then we also are very involved in capacity building, where we partner with fellow organizations like we are doing today with CASSA, with different corporates to help educate in education, translation, and creating awareness from a queer perspective for the communities that we work with. So that's a little bit about ASAP. So the three presenters who are presenting today along with me are going to be Adol, Shaz, and myself, Ty. We're going to start off today's presentation with a short poll that we are running. Now, this poll is just going to be, to test your knowledge. And I wouldn't really say test, but just to see where you stand on knowledge around HIV and AIDS, PrEP and PEP, testing, medication, and U equals U. So we're going to start off with a short poll. There are about 5 questions. And my colleague Adol will now share the poll.
Okay, hi all. To access the poll, please go to the link that I provided in the chat with the voting code. I will now share my screen so everyone can take a look.
So just to add to what Wardah just said, that you will answer all the questions, and then once you give the answers, we will go through each question and discuss the answers.
So people have already started using the link to access the poll. That's great. Okay.
Great. The first question is, AIDS is the same as HIV?
So if you haven't voted, I request you to please go ahead and vote. If you're having any issues, please reach out and let us know.
I can move to the next slide now.
Sure. Second question, once a person has AIDS, they have a short time to live.
Okay, Adil, I think we can move
Go
to
to the third question.
the third question.
HIV spreads through saliva. Okay, we go. Next question, please. Taking PrEP can prevent STDs and STIs. Next question, please. PrEP is like the morning after pill. Next question, please. U equal U applies to sexual intercourse only. And thank you, everyone. What we can do right now, I'm gonna reshare the screen and we're gonna go through each topic by itself and give more information. Okay. Is the presentation showing this time?
Yes.
Perfect.
Yes.
So thank you everyone for participating in the polls. I just wanted to add the very fact that we have a variation of answers clearly means that everyone's knowledge is at a different level. And that's what we're here for today, to make sure that everyone has a very clear idea when these topics are discussed. So our first question today was AIDS is the same as HIV. And I'm going to invite my colleague Shaz, who will take you through what it really means.
Yes. Yes. So AIDS is not the same. It's not the same as HIV. HIV stands for human immunodeficiency virus, and the virus attacks our body's ability to fight infection. If a person living with HIV does not have access to HIV medication or does not take the medication, their immunity is vulnerable to various infections and AIDS, which is autoimmune deficiency syndrome. AIDS is a disease that has 25 or more different conditions. Healthcare providers will say a person has AIDS when the person's T cell count is at 200 cells per cubic millimeter of blood. So in the charts, it's 200 at or below, and the person is known as an AIDS patient. Thank you.
Thank you, Shaz. We'll move on to the second poll, which was once a person has AIDS, they have a short time to live. So this question, we had one person who said yes, 5 people who said no. So idly in the 1980s and 1990s, people who were still dying of AIDS due to the lack of access to safer and affordable HIV drug treatments. Nowadays, however, people are living longer with advances made in treatments. Access is still an issue in some populations, which we all know about, but agencies like ours, ASAAP, CASSA, a lot of other agencies are working with its service users to make sure that treatment is available to all. So even if someone does have AIDS and is under the right treatment, is constantly and regularly going in for their checkups, eating healthy, they can, as Shaz explained earlier, their T cell counts, which were 200 and below, can start climbing. And that would mean that they no longer have AIDS and they're back again to being just HIV positive. So even if someone does have AIDS, they can get better, which is usually a myth that we used to have earlier, that once you get AIDS, it's the last stage and there's no hope after. So there's also a resource over there for anyone who would like to click on it and have more information on this topic. We'll move on to the next one, which I invite Aldo.
Thank you, Ty. For the third question, HIV spreads through saliva? No, HIV cannot be spread through saliva. It is spread through anal and vaginal sex with a partner living with HIV, and no condoms were used and/or no medications were taken to prevent or treat HIV. Second, anal juice. Third, sharing drug equipment like needles with a person living with HIV. And in this case, the U=U does not apply to acquiring the virus through substance use. And fourth, through vertical transmission from laboring person / person going into labor to child. For the fourth question, can I ask Shaz?
Yes, so next question, yeah, next statement is taking PrEP can prevent STDs and STIs. No, taking PrEP can only prevent a person from contracting HIV if taken as prescribed. So I think there's a 30-day usage, but it's ongoing. It cannot prevent other STDs and STIs. So in that case, a condom, an insertive condom would be great. Next, I invite Ty.
So the reason this question was included in the polls is because we often get questions around PEP. And that PEP is like the morning after pill. So a lot of people think that within 72 hours, you need to pop a pill and you'll be fine. The answer is no. We had 4 people who said yes and 1 person who said no. PEP does not work like the morning after pill where you just have to take 1 pill. You would need to prevent the HIV infection. It is actually taken over a period of 28 days and as prescribed within 72 hours of exposure to HIV. The HIV negative person remains under treatment for 28 days with regular check-ins from their healthcare provider and team. So we often get people who actually think that PEP is 1 pill that needs to be taken. It's not true. It's actually an entire course for 28 days where you're monitored when you're taking, and then they also do checkups to make sure that that you haven't got the infection. For our next question, I would like to invite Aldo.
Thank you, Ty. For our last and 6th question, the U=U applies to sexual intercourse only. The answer is yes. U=U expresses the fact that people living with HIV who take antiretroviral medications daily as prescribed and who maintain a durable undetectable viral load do not transmit HIV to their sexual partners. When a person has had an undetectable viral load for at least 6 months and maintains good adherence, there is effectively no risk that he or she or they will sexually transmit the virus.
Thank you. I'm sorry, Aldo, did you have anything else to add?
No, I was actually just gonna ask you to go on.
Okay, brilliant. Thank you, Aldo. So I do see a question that has come in the box, which was, what is the difference between PrEP and PEP? So I'm just going to quickly answer that. PrEP is usually a longer term medication, which is taken as prevention. And that's why it is, basically, we take it over a period of time to prevent HIV. So if you look at the full forms of PrEP and PEP, PrEP is pre-exposure prophylaxis, which means that we're trying to prevent someone from getting HIV, while as PEP is post-exposure prophylaxis, which means that if you feel you've been exposed to HIV, then you start the treatment of PEP. So PrEP is basically someone who is sexually active and feels that they have a higher chance of getting HIV. They get on to PrEP and take it over a period of time as long as they are sexually active. While as PEP is usually if an accident takes place and someone feels that they were exposed to HIV by someone, that's when they will access PEP. So I hope that clears the question around PrEP and PEP. Okay, so we're moving into our presentation on the COVID impact on South Asian, Middle Eastern, and Indo-Caribbean communities. I'm going to start off this presentation. So my name is Tai, and I am the manager for sexual health programs. I head the education team at the Alliance for South Asian AIDS Prevention. A lot of our work within the education team has to do with education and training for newcomers as well as existing community members over here. So we conduct regular workshops, we do training events, educational programs, and we invite various specialists to come and speak at these events, just so that people receive the right education and up-to-date information that they require. We also do a lot of social gatherings, which help with making sure people are not isolated. We bring people together so that they can connect within community, build bonds and build friendships. We do outreach at various events. So whether it's community events, whether it's at the bathhouses, whether it's at the bars, or festivals, including Pride, where we actually go out, we distribute condoms, safe sex material, and also information. And then also we help with the day-to-day planning of everyone's lives in terms of if they need help, if they need to be referred to, say, mental health services, harm reduction services. We make sure that they're connected to the right place and receive the right support. So what has the COVID impact been on the various communities that we work with? So let's look at one of our main functions, which is education and training. Pre-COVID, we used to have a lot of training programs. Every month, we would have 1 or 2 training programs where we would invite people to come to a safe location, offer them snacks, and it would be a get-together, but at the same time, they would receive education on a lot of programs pertaining to how to better their life. Now, these programs would vary from skill development to will issues to a lot of things that people really need to integrate into community and have a better life here after moving here from various countries that they have come from. That has obviously been hugely impacted because we're unable to do in-person programming anymore, and we haven't been able to do throughout the pandemic. Obviously for the health of not just the staff, but also our community members. So with these programs moving online, obviously we faced various challenges. A lot of people are not connected to Zoom. A lot of people don't have the technology to access Zoom, which is a lot of things that which is a huge barrier that not a lot of us think about. I mean, everybody thinks that, oh, we have a smartphone, how difficult it is to access a Zoom call. But it's not just a smartphone. It's about internet connection. It is about being able to access a Wi-Fi when required. It's about having a smartphone that supports the Zoom function. So a lot of our community members kind of got displaced, and we lost out on a lot of our community members when all this programming went online. And to be honest, it didn't even happen immediately because a lot of us were still trying to figure out what was the best way to keep the community engaged and to make sure people would still access this information that was important to them. So in that time, we did lose a lot of people who either moved out of the city, a lot of people who lost their jobs, a lot of people who moved to different areas. And all of these things combined led to the fact that today, if I have to compare numbers, in the past, each of these training and education events had close to about 35 to 40 people that would attend each workshop. Today, those numbers have gone down to about 10 to 12, or at the max 15. And that clearly shows the difference between what it used to be pre-COVID and what it is now with the pandemic. So clearly, education and training, while we still move forward, while we try our level best to make sure that these programs are conducted, clearly we don't. A lot of our community members do face barriers accessing them, and that's about our education and training bit. Another thing that was hugely impacted because of the pandemic was social gatherings. In all honesty, a lot of our community members live within the city or just outside the city alone. They've left their families behind, they've left their friends behind and moved to Canada. And their only sense of family and friendship and bonding were these events that we used to hold on a regular basis. Yes, some people are more expressive and more outgoing, and they did manage to have their own friendship and their own friend circles here. But there are a lot of people within the South Asian, Middle Eastern, and Indo-Caribbean communities who are still learning to connect to the population at large. So they are quite isolated. They still are taking time to come out and be comfortable in a lot of these spaces. So these small social gatherings, which were specifically for the community, so it was either a South Asian event or a Middle Eastern event or an Indo-Caribbean event, where people would come together, be among their people, be comfortable, be in a judgment-free zone, be in a safe zone, and actually get to just, as they would say, let your hair down and enjoy yourself. That was what these social gatherings would offer. But it would also offer connections to other people, friendships, bonding, knowing that there are other people just like themselves who are queer, who are confident in their skin. They would draw that confidence from others. All of that stopped because of the pandemic, and a lot of our people moved back into isolation. Isolation can be very, very stressful. It can cause a lot of anxiety, especially to people who are living here. Alone, without family and without friends. We've seen a spike in mental health issues, obviously, because of people being isolated. We've seen a spike in people not knowing what to do, where to go, and what to access because these social gatherings no longer take place. We've also seen a lot of people who, have frantically called and gone to the extreme of feeling life has come to an end for them. And that is the saddest part of what the pandemic, of what the outcome of the pandemic was. Yes, we did try to have a lot of our social gatherings on Zoom, but let's be honest, it's not the same thing when you have everyone together eating the same food. One of our most successful programs was the Cardamom Kitchen, which we used to do at least twice a month. And we used to do them in different areas, like in Scarborough. We would do it towards the west, and then we would do one at downtown. Cardamom Kitchen was where people would come together, cook traditional food that usually was cooked in their home countries and from their culture. And then everybody would share that food and eat together. And during that entire time, we would usually do a small little workshop. We would do games and, kind of make sure everybody has something or the other to take away from that event. Since the pandemic that started last year in March, that was the last time we ever did a Cardamom Kitchen. After that, we haven't been able to. And yes, there is a ray of hope that we may move in that direction where in time we can still have in-person programming, but let's be honest, it's been a long time that we haven't been able to do that due to restrictions. Outreach also was another thing that completely stopped, because outreach was about going into bars, into community, into events, and actually distributing safe sex materials, information, and also connecting with people and giving them help if they needed it on the spot. With outreach stopping, because most of the bars bathhouses and community spaces all closed down, we weren't able to distribute a lot of these safe sex materials. And that is a cause for concern. A lot of times at outreach, we would make sure that people understood what PrEP and PEP is, and we would make sure that they knew where to access these medications. With isolation, a lot of these people have no access to this information. They don't even have access to free sexual health materials. That can be really, really dangerous because right now we have people in isolations, and usually people in isolation try various things to cope with it. And some of that could also mean risky behavior. And having access to sexual health materials always helped in the past. Now, that is not really the case. So yes, definitely COVID has impacted the outreach bit, and we haven't really been able to start outreach on the large scale that we used to. And I mean, I know at some times during our events, we would distribute close to like 2,000, 3,000 condoms. So that's the kind of numbers we were looking at in distribution. We don't do that anymore. And then of course, the day-to-day lives of our community members, we've tried to be there to be as supportive as possible, helping them to access medication, helping them when they called up frantically saying that they have lost accommodation due to the pandemic, or a lot of them who lost jobs. A lot of our community members are not in the high social ranking when it comes to jobs and earning salaries. A lot of them are doing part-time jobs. A lot of them are working in grocery stores, in restaurants, in pubs. When all of that shut down, automatically a lot of them did lose their jobs. And then because they weren't able, when they lost their jobs, that's their source of income gone. So they had to move out of their current accommodations and then move into cheaper accommodations. A lot of those cheaper accommodations weren't in very safe neighborhoods. We had a lot of our colleagues who, a lot of our community members who were trans and had to move to unsafe neighborhoods, who were out gay and had to move to unsafe neighborhoods. So that really hugely impacted that. And when you move into such situations, it just gives rise to a lot of anxiety, a lot of isolation, a lot of fear. And that's where a lot of our people are still in that situation even until today. One of the biggest setbacks were a lot of our refugee community members could not deal with the situation and ended up going back to their countries of origin. And I mean, someone coming here as a refugee, what we need to know is that they are fleeing a bad situation. They're fleeing a very, a situation that they cannot really live in. And then to have to go back to that situation can be extremely painful for them. But a lot of them did have to take that decision and go back. So if you see overall, COVID has really impacted all the areas that we have faced that we usually do our work in. And while we have tried to move a lot of it online, I would say we still hope that we can reach out to a lot more community members than we are doing at the moment. So I'm going to stop over here. If you have any questions, do put it into the chat. And while you're doing so, I'm going to invite my colleague Adil, who will present the next part.
Thank you, Ty. COVID impact on newcomers. I arrived here during COVID, during lockdown. And so I experienced two governments implementing two very different responses toward the pandemic. And if I also include what we see on international news, I would say, in my opinion, the Canadian government have had a good emergency response toward the pandemic in comparison to a number of other countries. But this emergency response, the way it was and does not support all the members of Canadian society equally. And here I'm focusing more on newcomers and specifically refugees and people seeking asylum. First point, accessibility. This emergency response, which includes raising awareness, vaccination strategies, social distance regulations, and lockdowns. It relies heavily on more on providing services over the phone or filling an online application for vaccine registration, as well as spreading awareness online. This is a great approach if you can speak the language and have access to computers or smartphones, and if you have skills to use them. Most refugees, they do not have access to those specific skills or devices. And they end up not receiving those services, whether it has to do with registration for vaccination or knowing where to go, which clinic and how to get there. An emergency response have to keep adapting and changing, not just to respond to the COVID numbers, but also to improve, to make sure that everyone is supported and no one is left behind. Because we have members of society that are not receiving the support that others are. And in Canada, with all the diversity here, this is not just a SAMEICL refugee problem, but a problem that is affecting many other members and communities across the country. And this is where ASAAP and other similar agencies like ASAAP come in. By supporting newcomers with system navigation, understanding the procedures and the steps, as well as interpretation support, the newcomer will know what their options are and how to get vaccination and where. The ASAP staff, as I'm sure other agency staffs, have been constantly in contact with their clients to inform them of every pop-up vaccination clinic. Our social media channels are pretty much covered with every flyer of all the agencies in Toronto explaining where are the new places and what dates, as well as staff being on the field, supporting clients with registration as well as language support during their visits. The other two options are a bit similar, but in different phase for the newcomer. The first one being burned out upon arriving. We need to stay mindful that a newcomer, and specifically a refugee or people seeking asylum, they came here because most of them have had a lifetime of oppression related to racism, transphobia, homophobia. And for many, they were living in countries that are going through a war or has corrupted or abusive governments. When they arrive here, with all of those experiences, all of those traumas they had, those experiences and traumas don't just go away. And for a newcomer, their perception when it comes to the importance of vaccination is always compared in their mind with their previous trauma, their previous experiences. I'm going to give an example here. I had a client months ago, and we were discussing the importance of vaccination and what are the ways to register them for their first shot. Their response was, I'm living with HIV, and I already survived a bomb that exploded near me and caused me serious back injury. I can't care anymore about a new experience, new problem, a new pandemic. And the first thing that came to my mind when I heard that was the word can't. It's not like I don't want to care, I can't care. I'm emotionally unavailable to care anymore for some other urgent matter. And it was a sign of how much burnt out they are, even though they just got here. So in such a situation, we move the conversation, we change. Instead of discussing vaccination, we discuss their experiences. And I'm already aware of what they've been through. We already went through these experiences before many, many times, but that's okay. With the service user, with the client, they need to talk about this as much as they feel they need. And by creating this kind of dialogue, after that, they feel better. They are able to be more receptive into discussing vaccination and different process. This method is not a 5-minute conversation. It's an ongoing dialogue, but it ensures that the newcomer is more open and care about getting the shots. This is not a one-time set in conversation, but normally can happen throughout a week. A conversation that sometimes can take days. Third point, overwhelmed within the first year. After arriving to Canada, getting papers done, finding a home, and for many of refugees, they're actually living in shelters. Worried about finding work, financial security, disconnected from their loved ones abroad, and unable to connect with anyone from anyone here because of social distancing regulations, as well as language and computer skills barriers. All of those can be overwhelming for a refugee or a person seeking asylum. All of those are overwhelming to any one of us here also. And therefore they cannot prioritize getting the shot on their list of issues when they are currently going through all of this together combined. So similar to the approach with the previous points, the solution is really, when it comes with newcomers, a holistic approach. At ASAP and other similar agencies, we advocate the urgency of getting vaccinated to our clients, but we're also supporting them with their urgent priorities right now. And many times in a meeting with a client, all those topics that were mentioned before, as well as vaccination, they're all discussed and intertwined into one conversation. After discussing with them their other priorities, whether it had to do with doctor appointments, home problems, shelter problems, food bank, building their own resumes to apply for work, they become more receptive to discussing vaccination itself. Thank you. I will be checking the chat for any questions, and I would like to ask Shaz. They will be discussing COVID impact on clients.
Thank you, Adil. So that was great. We heard from Kai and Adil about newcomers and about, community members and the impact of COVID on these communities that we serve. I'm going to focus on people living with HIV and also affected their family members, their friends. So I'm going to sort of go into these a little bit more in the next slide, but these are ways that, sorry, back to the first slide. Yeah, I think. So these are ways that we at ASAP and also our partner agencies, aid service organizations, we try to, like put in place to help our clients, deal with COVID. Now, I'd say yes. According to the support team, there are maybe 50% of our clients have been vaccinated, like both shots, and the other 50%, I mean, it could be like the other 40% and the other 10%. So let's say the 10% have gotten their first shot, and the 40%, there could be a number of reasons, and I'll get into that later, but we try to support them through training intervention, a training intervention, and I'll speak on that a little bit later, one-on-one support, and that could be through phone check-ins, which, we do like every week with some of our clients. With others, they might prefer like once a month or once every 2 weeks. Are made. So, at least that's a good thing. The online events. Now, Ty did mention the effect or the lack of effect of Zoom meetings and workshops and whatnot. And yes, I do agree that for support gatherings, we used to have them, in person before the pandemic hit. And now we've gone online, and it has not been the same. We've lost quite a few, like people from, coming or attending because as I said, they don't, they don't have Zoom, they don't have a computer, they don't know about this. So we need to figure out how to be accessible with those clients, and that's always a challenge. Oh yes, so next I will list maybe some of the so these things, like the first column, they do happen, apart from COVID, because of how HIV is stigmatized in society. Like, they're stigmatized, and also think about, the communities that they represent, right? Like they represent, BIPOC, Black, Indigenous, people of color communities. And so, on top of that is an HIV diagnosis. They are, they might not have told their family or their friends, but the ones who have, might be accepted, or they might not be. And, the majority of our clients who are dealing with HIV on their own, not, had that conversation with their, with their loved ones, because they are afraid that, they'll be, abandoned, I guess. And so isolation and loneliness are, big, big things that happen, and they happen within the context of HIV. But now that there is a pandemic and there are shutdowns, lockdowns, whatever, it's even more intense. And it can take place, like it can manifest in different ways. Like a person, not eating foods, whatever is healthy for them. Person not, accessing care and support, staying disengaged from community. And they don't do this, by choice. It's kind of important to remember. They do it as if it's kind of like an impulse, and they don't want to do it, but they're put in that position to be isolated. And for some of our clients who don't live in Toronto, they live in the GTA, loneliness is exacerbated by distance, single unit dwelling. Other things happen: forgetfulness, emotional imbalance. They might not have anyone around to express their emotions. They forget maybe to be in society, you know, and their thoughts are racing all the time. Maybe they have some physical impairment already. You know, it might get worse. It might another one might develop. Whatever. It's usually in the legs and feet, and their space, like over cleaning or not cleaning at all. So these are just some of the responses to COVID. The other side of this is I've been hearing a lot of things that our clients have done to, you know, sort of a sense of resilience. And, you know, some have, you know, gone for short or long walks. They go by themselves, or they might, you know, call up, you know, a friend or a peer, and they'll go. They, you know, they stay connected through check-ins with their loved ones or with right. They get the most out of their local food banks, because the food banks don't always have the kinds of food that they'd like to consume. So they try to pick out the best of the bunch. And they stay engaged in care. That could be with their peers, that could be with their loved ones, that could be with social service providers like us. And they also stay connected to their healthcare providers. So these are just some of the ways that our clients have shown their resiliency. Yeah. So next. So yes, so I want to quickly say something about CHAPS in Action. CHAPS in Action is a project. It's an alliance of 5 AIDS service organizations, with the lead organization for accessible AIDS prevention. So that's the leading committee, and then we have ACAS, Center for Spanish-Speaking Peoples, and Africans in Partnership Against AIDS. So, we've been doing this for 5 years. So next year, next 6-7 months we have left, and it's a groundbreaking training intervention, right? So that promotes individual and collective care, compassion, advocacy, and knowledge sharing of social justice issues. The training uses the ACE model, which means acceptance. So acceptance of one's, of oneself, of everything that is you. No matter if you have flaws, if you have your flaws and your good things, the advantages are are all one, and we learn to look at ourselves as an observer, to think about not think about it, look at our thoughts, observe our thoughts, and allow them to exist, get tied into them. So The training enhances our capacity for self-healing as well as collective healing. And that comes through mindfulness in daily life. So mindful, I'm watching, the dishes. I'm not thinking of anything else. I'm just looking at the suds and thinking, this is, great. So another thing about mindfulness is it does get you to think about the people involved. So the networks that are created through soap, right? So who are the makers? Who are, the farmers? Who are, um, the people who are selling it? Um, and it does, connected to social justice. It does connect us to other marginalized populations and communities that, are actually a part of this great big network and who need support. There's also mindfulness meditation and values, our individual values and societal, and how those values can be used to work towards our goals. And our goals can be something simple, like, let's say, write a short story, right? Or it can be something, that involves more people, like, let's get out on the streets and do something about, what's happening in Afghanistan. So then there is also psychological flexibility. And what does that mean? It means that in times of conflict, when there is tension between us and other folks, other people, we develop the sense where we are aware of the sense that this person or these people are simply, putting their views forward, and we don't need to enter into any kind of, right? It's more that we relax into ourselves. We allow the space, whatever, to hold our different points of view. And also advocacy and social justice. Advocacy is, we're not supposed to use that word. Many years ago in nonprofit, we use it now and we use it a lot. So advocacy that connects us to, social justice. And social justice can be something local or global. So the chaps in action training, if you go to the next slide, it will be offered in the fall, sometime October to November, and the dates will be fixed. And it's a 6-week online group training sessions, and the recruitment starts in September. And if you want more information, you can contact me at phasupport@asap.ca. Thank you.
Thank you so much, Shaz, and thank you to all of our speakers. I really appreciate you taking the time and educating us all on, the impacts felt by COVID. I echo the point of, engagement is so much more difficult now. Getting the same numbers is difficult, reaching the same communities is difficult. And even when I was arranging this webinar, I had this conversation, and a lot of people, asked me, and I raised this to Adil as well, is what work do you think still needs to be done to address systemic issues the pandemic has shed light on, right? I think his response was brilliant. He said that the pandemic really just emphasized or worsened the issues that society had already been neglecting, right? So this pandemic has, in a sense, opened our eyes to the things we kept in the dark for so long and hidden. And before we even begin to talk about recovery from this pandemic, we need to first talk about, well, why do those, inequalities exist? And why is there such an alarming rate of social disparity? And how do we, before even talking about recovery, why don't we talk about those, right? And what we did here today was such a good example of that, whether it was even your story about the newcomers or even about the numbers going down, this is all reflective of that COVID experience. So I want to thank you so much from CASSA for coming out and sharing your experiences. And I'll be sure to circulate the training session. So all who, attended today. Oh, I have another question here before we just sign off. Hey, I'd love to hear more on vaccinations and those mandatory policies. So anything that you guys have heard, maybe just to end us off here, about what have been people's feedback on vaccinations and mandatory vaccinations and that kind of conversation.
Yeah, so the clients who haven't been vaccinated yet, some are, it's just a case of, right? So there, we are trying to connect them to vaccine, places where they vaccinate through our vaccine ambassadors. That's Ravina and Shrutika. They hook people up, they connect people to these different places. Now, unfortunately, some of the folks are living outside of Toronto, so we have to do some extra searching for drop-ins, whatever. Now, also, there are people who are hesitant about getting vaccinated because they have HIV. So we've shared with them the Katie, everyone knows Katie, where everyone gets their HIV and Hep C information from. And Katie does some great webinars on COVID-19. And so they did a webinar on COVID and HIV and how the vaccines, might impact you if you're living with HIV. And they found that vaccines are, they're healthy. Instead they will, I think, promote health, wellness in clients. So we've shared with them the webinar where all of this is full, whatever. And we've also used, I've used, myself as an example where, I'm vaccinated and I didn't have any health effects. So it's not to say that, the other person is going to have similar reaction. They might have a different reaction. But I don't know because I'm not a doctor. But, I do try to reassure them that support is there. The vaccines are for your health and safety, and also to allow for a little bit of in-person
Great, thank you. And on that note, we can conclude. I want to reiterate that, again, I agree with Shaz completely. It's about, health and safety, and it's about building that trust, right? So just to let all, if you do outreach work by any chance, you have to kind of first go in to understand the mindset of someone getting vaccinated and any concerns they might have towards their own health, right? And if they happen to be HIV positive, you have to take that into account. And you can't speak as a medical professional, but you can grant like a listening ear, right? And with any information you might have learned today or from, beyond, even if we could get, a list of resources or a link to those webinars, that'd be great. I could send them out and follow up with everyone. Thank you so much for everyone for coming out, and I hope you have a great rest of your evening. Thank you.
Thank you. I just want to, Wardah, thanks for the opportunity as well.
Yes, of course.
All of us at ASAAP. Thank you so much.
Thank you.
Bye.
Bye-bye.
Bye.